thanks to Dr. Nagaraj Desai, Dr. Prabhakar, and Dr. Hinga for compiling this, because invariably in our practice, or at least in learning stage, we ignore statistics. And as years pass by, biostatistics occupy a major part in our learning, or at least understanding the various clinical trials and the significance of these trials and how they affect our practice. So it is a very good initiative, and I must say this is also my first true, learning process of biostatistics. I mean, here and there we have read and we have learned a little bit about biostatistics, but I'm also learning a lot of new things during this meeting. I'd like to welcome Dr. Denis Xavier, Professor of Pharmacology, as well as Head of Department of Clinical Research in St. John's Medical College, Bangalore. Of course, most of us who have been involved in some kind of a clinical trial or other are quite familiar with Denis Xavier, his contribution and his association with Salim Yusuf, and the contributions to the clinical trial scene in Bangalore. So I would request Dr. Denis Xavier to give his perspective on the a part of biostatistics, that is parametric measures. Dr. Denis Xavier, please.
Thank you, Dr. Ramesh, for those kind words. It's nice to meet many friends virtually like this, and thanks also for this opportunity to share a few thoughts on biostatistics. And like you correctly said, this is becoming more and more important. So can I have my first slide up? Okay, yes. So today the first talk is on parametric tests, and we're going to be speaking about t-tests, the two types of common t-tests that we do, ANOVA, and at least two types, time permitting, we can do the third type. I'm sure all of us have experienced or tried to do these tests during our MD thesis or in our other research projects. So here we go. So firstly, the difference between parametric and non-parametric tests. So there is a bit of jargon over here, and I'm not going to go through the entire slide. Later, all these slides will be available to you. Later, you can go through it in greater detail, and we'll see this same slide at the end of the talk as well. So the difference in parametric and non-parametric, we'll look at least in terms of the assumed distribution, the kind of data, and the central measure that is used, and all these terms will be quite common to you now. So we use parametric tests when the data are normal and when the variance is homogeneous. We'll leave that for now. We'll move on to something more common, which is when the central measure is a mean. So clearly there are certain situations when we use a mean and certain situations when we use a median. When it's normally distributed and we know that the sample has come from a large enough population and we have sampled randomly, mean is used. If there are large outliers, if you look at the data, then median is used. Now, if you have 30, 50, 80 data, we can do that, even looking at it, physically, eyeballing the data. But if we need to check if the data are normal or not, there are statistical tests and also visual methods by which we can do that. And we'll not go into that now. So parametric tests we use when the distribution is normal and when we use mean as the central measure. Non-parametric on the other side, on the other hand, any type of distribution we can use, and even if it is skewed, if there are outliers, etc. And then when median is taken as the use of central measure, or for the average when we take median. And what are the benefits? Parametric is stronger, I would say, in common language, and we can draw more conclusions. Non-parametric, when we cannot do parametric tests, we use non-parametric, and we have a talk about non-parametric tests immediately after this, so I will not go more into that. Few other things to look at in terms of what are the correlation tests that we use in parametric tests and in non-parametric. When there are independent measures with two groups, more than two groups, repeated measures with two groups or two conditions, not groups, and repeated measures when there are more than two conditions. Now, when I'm going to display the rest of the slide, I'm sure many of these names will be familiar to you. And, this structure or the schema, if you have, it becomes very, very easy for you to choose a particular test. Okay, so for correlation test, it is Pearson's, and Dr. Tiny and I spoke about Pearson's. And on this side, if anybody remembers, it is Spearman's test, right? If it's an independent measure with two groups, it's a t-test, or a simple t-test, we call it, right? If we have more than two groups, we cannot use a t-test, and we're going to discuss why. We use ANOVA. If it's repeated measures with just two conditions, we used a paired t-test or a match paired t-test. And if you have more than two conditions, we use either a one-way ANOVA or a repeat measures ANOVA. Now, on the non-parametric side, when I show the rest of the slide, you will find some, maybe even some uncommon words over here or names of tests. And this is what. So Spearman's, yesterday we spoke about. And if you have the non-parametric version of the t-test is the Mann-Whitney test. And then that of ANOVA is the Kruskal-Wallis test. And the match pair t-test, when we have like a before and after test, is the Wilcoxon test. And for ANOVA, it's the Friedman's test. Today, we're going to be speaking about t-tests and ANOVA. I hope that is clear for you. And let's get to familiar territory where we speak about cases. Now here, it's not a cardiology case, but it's a case of, or an example of a clinical trial that we did. Very simple, new drug for hypertension. It's a randomized, controlled, double-blinded study, the standard design that we use to evaluate any treatment. So control group gets a standard drug, and the test group gets a new drug, right? The patients are of either sex, adult patients, and this is the definition of systolic blood pressure for us to include them. Total sample size, very simple, like a PG thesis maybe, 30 patients, randomized 15 each, 15 in each of the two groups. The primary outcome is the change in systolic blood level from baseline up to 12 weeks, which again is quite common. Right, so to keep things easy, I have just these 15 participants, and this is the change in systolic blood pressure from baseline. In the control drug, these were the changes, and in the new drug, these were the changes. So if you just eyeball this data, just look at the numbers, all these numbers seem to be larger than this. Everywhere you see larger, larger. Sometimes the margin is very small, sometimes it's very large like this. Okay, overall, it seems to be that this new drug is reducing blood pressure more than the control drug or the best possible drug at that time. All right, so is this good enough? Not really. So what do we do next? We look at the results, right? What did this happen due to? So we look at baseline characteristics. These two groups, okay, they were all similar in age and sex and other background conditions, etc. Adverse effects were the same in both groups, so nothing to choose in that. So then we look at what is the mean change in blood pressure in these two groups. In the control group, it was -8. And that in the test group or in a new drug group was -14. So we're very happy that what we thought of before we started, that this new drug is going to reduce blood pressure even more, actually worked. Now, there are two questions. Is this new drug better than the standard drug? If I just look at this, yes. Okay. Now, will you give it to everybody now? Okay. So that is where we have in this trial, in this study, so there was a 6 mm difference between these two, and we say yes, but giving it to the population, oh, we need to do significance testing. Is this difference really significant, or is it just due to chance? Suppose I go and do it in another population, will I get the same? I've done it on 30 people. Can I go and give it to 3,000 people? Not sure, right? So we need to do significance testing, and that's what we come to the t-test, right? Blood pressure. We can reduce it to a mean, and that's a parametric test that we can do. And the t-test, very quickly into history, we need to acknowledge all these gentlemen. William Gosset was the person who came up with the t-test. He actually worked in a brewery in Dublin, and he also dabbled in statistics. And student was his pen name. You may have heard of this. He published this 122 years ago, 12 years ago, so over a century ago, and more or less the same principles we still use. So moving on, what are the t-tests? What are we trying to do? We are trying to assess whether the means of the two groups are statistically different from one another. We have 6 and 14. Is this statistically different, right? So let's look at it graphically, right? Here we go. So this is the control group, and this is 8. This is the mean, and this is the treatment group, and this is 14, right? So we saw this. Now, what are we seeing here? We are seeing some overlap here. We're seeing some overlap here. So people who got the new drug also had very little blood pressure reduction. People who got the old drug had quite a bit more than this here. So what is really happening, right? So this is as simple as we can keep the t-test as. So this is used for interval or ratio variables, which we are dealing with now. There are several assumptions that must be fulfilled before we are able to do the t-test. And there are more than 7 or 8. I just put up 4 of them. So this is quantitative, distribution is normal. So the first thing a statistician would do is test for normality, right? We can visually test it, we can statistically test it. We can use the QQ plot, there's a Shapiro-Wilk test, there is a Kolmogorov-Smirnov test. So these are all statistical tests for normality. And we verify all of this. We say, okay, we are good now to do the t-test. Right, so keep this image in mind as we move along. You're going to see this once more too. T-test, what are the types? We can do a one sample t-test, right? Just take one sample. Just forget about the case we did just now. So just to look at what are the types of t-test, one sample t-test, we gather a sample, it could be a class, right? And then we measure their age, right? Age standard in this particular class. And then we compare it with a sample mean of the known population, all 8 standard students in Bangalore city. Are they all the same age? So we can compare these two and say, okay, this is not different from them. That's a one sample t-test as a very simple example. But let's now discuss about the 2 sample t-test wherein we compare independent samples or dependent samples. What are these? Independent samples, we use the unpaired t-test, and for the dependent samples, we use the paired t-test. And we're going to discuss both of them just now. Am I audible so far? Are the slides moving fine and everything okay?
It is perfect.
All right, thank you, sir. Let's move on. Right, so understanding the t-test. What we need to do now is to discern or differentiate, right, between the means. So first we have a signal. Our treatment has caused a difference between the standard and the new treatment. That's our signal. But there is also some noise. There is variability. There is change in blood pressure that happens in individuals within each group. Within each group, there are changes in blood pressure. So that can be noise. It need not be just due to the treatment that has happened. So therefore, in very, very simple terms, the formula for the t-test is a ratio of the signal to noise. The numerator is the difference between the two means, and the denominator is the variability or the dispersion in the scores within those groups. Right? As simple as that we can keep it. So let's look at this now. So this is the signal to noise ratio that I spoke about. So this difference between these two means is the numerator, difference between the group means, and all these differences that we are seeing here is the variability in the groups. And if you're interested, this is the treatment minus control and the standard error over here. Let's not worry too much about that. So the numerator is difference in the means, denominator the standard error of the difference. That is the formula if you're interested. But let's now actually look at this one. This can look complicated, but don't worry. This is an output from SPSS, which is a very common tool or a statistical package that people use. And I will explain this step by step. So we have 15 in one group, group 1, group 2, 15 here, mean of 8 and 14, right? So we got this difference. And now what we are trying to do, and I'm leaving out all these advanced issues that there's no time for today. So we are assuming that there is equality of means, and this one assumed, right? We are looking, the mean difference between these two is -6, and this is the 95% confidence interval, -8 to -3. So when we're writing this, between these two groups, we say the difference is -6, bracket, 95% confidence interval, -8.31, -3.69 we write, right? And this is the significance level that we have got. What does this mean now, right? So we have found that this is the difference that we have got, and this is the two-tailed p-value. So SPSS gives it as 0.000. So when we write it, we write p less than 0.0001. So this is highly statistically significantly different. And And journals these days actually ask us for the lower and upper bound of 95% confidence interval. Right, so this is the unpaired t-test, as simple as we can do it, and also how to interpret something like this, an output that we get in SPSS. Most other R also gives it something similar. In fact, you can even do this on Excel. SPSS is expensive to buy, and yeah, even Excel we can do, and this is how we would get it. Let's go to case number 2. I have a research question here. Among patients with asthma, does relaxation training, maybe breathing exercise, maybe yoga, and others, reduce the need for medications? They take bronchodilators, they take steroid puffs, etc. So that's what a researcher wants to do. So he just takes 5 patients with bronchial asthma, and he measures how many doses of medication the patient took 1 week before the relaxation exercise and 1 week after the relaxation exercise training in the same patients. These are not 2 different groups. One group, okay, and found out how many times you took your medications last week, right? Out of 7 days, how many times? Okay, and then, okay, here is training. Now you continue with the medications, come back a week later. So here is it, and to keep it easy for us to understand, I've just made 5 patients here. So before the relaxation exercise, 9, 4, 5, 4, 7, etc. Right? More than once a day, roughly once a day, less than once a day. After relaxation, if you just look here itself, say, wow, this is reduced. It was almost 0. I didn't take a single medication. So there was no attack of bronchial asthma. So when eyeballing these data itself, we say, okay, this seems to have worked. But is this statistically significant is the question. So here we do the paired t-test. When the values are dependent, that means this value and the value of the 1 week in the same patient, we are going to measure, right? These are called repeated measures, and these are also known as pre and post intervention values for us to compare. We use the paired t-test. They're also called matched or paired values, or where one score is matched or paired with another in the same individual. How do we analyze these data? Right, we calculate the mean for both groups. The mean before was 5.8, right? In that first group, you would remember, you add up all of that, divide by 5, gives you 5.8. And after is 1.8, a difference of 4. So this seems to be, again, a very important difference. That's why I very carefully said important difference. The question is it statistically significant, right? Right, and again, in statistical teaching, it is told that unless it is statistically significant, do not say there is a significant difference. Significant as important in English is different statistically, right? So this is what we get now. So before we had 5 participants and later we had 5 participants. This is the mean before and this is the mean after. This is the standard deviation and standard error of mean. And the difference before and after is very easy to calculate here, is 4, right? And these are the lower and upper bounds of the 95% confidence interval. So when we write this, we write the difference before and after is 4, in bracket again 95% confidence interval, 1.52 here, 1.52 and 6.48. And if you want to give a p-value, p-value equals 0.011. And generally for p-values, it's encouraged to give 3 decimals. So this relaxation technique in just 5 patients, you saw a big difference, right? And even in this sample, it was found to be statistically significantly different. All right, so let's summarize t-tests. It's the easiest approach to compare 2 means. The unpaired t-test or the independent sample t-test is when the data are independent, and the paired t-test is when the data are dependent, but also used in before and after studies. So let me move on to the next section of our first talk, which is ANOVA. So we just finished these 2 tests. We're going to ANOVA. We'll do one-way, repeat measure, and multivariate, and we'll start off with a case. I'm not describing the case here. It's evident. 3 different drugs. We're looking at neuropathic pain and looking at pain scores, gabapentin, duloxetine, and pregabalin. This is not cardiology, but I'm sure these drugs patients would be taking, particularly those with diabetes. So there are 100 patients here. I can't show all the sorry, there are actually 300 patients here. They've been randomized to gabapentin, duloxetine, and pregabalin, and these are the pain scores. Higher the number, more is the pain. So if we had 100 here, could we make out the difference? Can we make out the difference now? I'm really incapacitated by not being able to see the audience without responses. So I'm presuming your responses, I'm not sure. I'm not sure if there's a difference between these three groups, maybe. And those of you very good with arithmetic would have quickly done the means over here for each of the groups. And here are the means: 6.2, 6.1, 5.6. Is this different? Is this statistically significantly different is the question. We need to find that out. Now, how do I analyze this? Right? Previous one seemed easy. There were just two groups and I did a t-test. And if there were two groups at the same time, that means these are independent groups. We did the independent sample. Now there seem to be three groups. How do I analyze this? Oh, okay, simple. I learned everything about t-tests. I understand the mechanism, signal, noise, etc. All that is fantastic. And SPS is so easy for me. So I'm going to analyze it like this. Okay, I'm going to take gabapentin and compare it with duloxetine. So I'm going to compare 6.2 with 6.1. Oh, I'm not getting a significant difference. Then I compare 6.2 with 5.6, marginally significant, 0.048, marginally significant, but still significant. 6.1 and 5.6. Oh, I'm getting a statistically significant result here. So can I do this? Unfortunately, although while it's technically not wrong, it's not advisable to do this. It's something like saying, I want to go to Delhi from here. Can I walk? It's not wrong to walk, but it's a really terrible way to go to Delhi from here. Oh, maybe I'll take a bullock cart and go to Delhi. Well, it's not wrong. You can still go by bullock cart, but it's really not a good way to do it. Is that, and I'm talking about 2020, not in the bygone days. So how do I analyze this? Why don't I use what I just heard now, which is using the t-test repeatedly? Can I do A versus B, A versus C, and B versus C? Why can't I do this? There's a problem. T-test is used to test the difference between two means, right? And also the standard error of difference between the two means. We leave that for now. The problem is in the next section over here, conducting multiple t-tests. It's not wrong, but there's a problem here. And since we've not done probability and significance testing, I'll take a moment to explain this, right? I think we are doing types of errors and all that tomorrow, I think, and also post-hoc tests are being done tomorrow. So in sequence, that should have been done before we do this, but it's okay. We'll go ahead. So when we conduct multiple t-tests, this leads to an inflation of the type 1 error rate. Because we are testing it more than once, the chance that we'll get, and I'm sure all of us are familiar that we allow for a 5% error. Doesn't matter, 5% error we live with, but the more number of times we do tests, the more number of those 5% errors. So we kind of keep multiplying those errors, and the level of significance we need to set for that is very high. So if you compare three groups with the usual 0.5 level of testing, which I just told you, A and B, A and C, and B and C, the chance of getting the wrong result is 0.95% into 0.95 into 0.95. And I'm sure we all remember 0.05 is the usual significance level we set it as. If you multiply all of this and minus it from this, we get a 14%, 14.26 to be precise, 14.3% error rate. We usually accept a 5% error rate. So to account for this, if we still want to do this, we're going to have a massive sample size. And again, why do we do that when we can do something different? So we are not going to do multiple t-tests, right? So we're going to do the ANOVA, analysis of variance. We're going to analyze the variance in this. So let's quickly understand what this means. This is used to test for differences among several means, minimum of 3. We can go more than that without increasing the type 1 error rate. So our level of significance, or in other words, alpha is still maintained at 0.05. And this is how we're going to do it. So ANOVA is a method of testing the hypothesis that there is no difference between more than 2 populations. And we are talking about at least 3 populations. And this is the ANOVA statistic, also called the F test. Just a little bit of statistical jargon here, developed by Ronald Fisher, who is credited with many tests. And he was an English statistician and a geneticist. And it's good to acknowledge these gentlemen who over a century ago gave us all these classic tests that we use day in and day out. Why variance and not means? I really wish I had more time to explain this, but we'll go through this as slowly as possible. Our attempt is to show that the group means are different. By how much the means are further apart from each other, right? So we have means of one group, we have means of another group, and means of another group. In the means itself, how much are they further apart from each other is called the variance. And therefore, we're going to compare the variability between groups and variability within groups. So when we take a population, when we take any sample, there is variance, right? There's variability between the groups. And nothing, although we'll say between 18 and 45 or even 18 and 22 if we keep the age, still there are differences in so many different ways. Things that we measure, things that we don't measure or cannot even measure. So there is variability between the groups. There is variability within the groups as well. And we're going to compare both. We're going to compare both and we're going to distinguish the difference between these groups. And we're going to see whether the variability between the groups is more than the variability within the groups. Whether the variability between these three groups is greater than the variability within each group, right? And if the within group variability is also greater than the between group variability. And any difference between the groups is actually now difficult to detect unless we do these statistical tests. Okay, let's go back to this example again of 300 participants, pain score 6.2, 6.1, 5.6. We take the mean of this one first, which is 6.1. The next few points are important. Even if the previous one, if we didn't get it really well, the next few, for you to just get a feel of what ANOVA is, right? The variability between groups is done in 3 different steps now. For any drug, we compare the group mean with the overall mean. This, right? 6.2 minus 6.1. Can we see this here? So this is the mean of this group A. Sorry, I should have said, gabapentin group. So this is group A, 6.2 minus 6.1. Then the overall effect of the drug is the sum of the group mean minus the overall mean, and it is squared. Let's not go into the statistics of this, why it is squared. And then we take the square root later on. So we leave out all of that. Then we take the sum of the squares between the groups, and then we multiply it, right? Sum of the squares into the sample size, and 6.91 is what we get, right? So then we can undertake the F test. So this is the variance between, this is again key for ANOVA. This is the variance between the groups, right? Which is given as the between group variance given as B square, SB square, right? Sum of squares minus K minus 1, 3.54 is we get, and this is the mean score between the groups. And variance within the groups, similarly, SW square, and we compute it and we get 1.98. This is the mean square within the groups, right? Forget about that, right? And this is the F test now. We divide SB square by SW square and we get 1.741. This is the F statistic. Even if you forgot anything prior to this, it is the variance between and variance within the groups, right? And we get 1.74. This is called the F statistic. I'm sure you've heard of the T statistic, the Z statistic in different places, the chi-square statistic. You will hear about the chi-square statistic from the next speaker, right? So this is the F test, right? And then, of course, if we were in a workshop situation and if we all had biostatistics textbook, we'll go to the end and we look at the F statistic table, and then we can look at the p-value for this particular number and the number of groups we had, which is the degrees of freedom, which I'm introducing for the first time, and then we accept or reject the null hypothesis. Now we're not going to do any of that. We're going to compute this and then look at it in a program such as SPSS and look at the p-value, right? That's what you're going to do. This is what we get. Now this looks pretty complicated for all of us now. Just follow my cursor, right? So gabapentin here, duloxetine, pregabalin, 100 people each. Do we have the mean here? Standard deviation, upper bound, all of that. This is basically a summary, right? We'll ignore this for now. And then we have the between group difference and then the within group difference, right? And we have the F statistic here. And this is the significance, 0.177. We had 300 people in this group, and we did this, between these 3 drugs, and we got the significance. So if you were sitting in front of me, I would ask you people, one of you to, interpret this. what does this significance of 0.177 mean? Let's look at the same thing again in a little more understandable manner, right? So this is the output we get, and this is how we can look at it, right? I'll skip this part of homogeneity of variance. We'll skip this, and let's look at this now. So we're looking at between groups, right? And we have three groups, okay? 3 minus 1, that's the degrees of freedom, is 2. And this is our mean square. And this is the F statistic, which we are already familiar with. And this is our significance. What does this mean? This is the main ANOVA result. The significance value comparing the groups or the 3 different drugs is more than 0.05. Okay, forget all this. Tell this to me in English. This is what we would say, right? When we gave 3 different drugs to control neuropathic pain, right? There was no significant difference in any of these 3 groups, right? Now we have 3 groups. Now you're going to ask me a question. No, what about A versus B, B versus C? No, for now, in our overall comparison with ANOVA, there is no statistically significant difference, right? There's no difference in mean pain scores. But somebody will say, no, I want to compare pregabalin with gabapentin, right? So this is how before we do that, this is how we write the results. There is no difference in the mean pain scores between the 3 groups. That's all. We can just mention that. But how will we write it in a journal, right? We need to give the numbers, okay? If there is a significant difference between the groups on doing ANOVA, it does not tell which groups differ. So right now, I'll go back now. We don't have a difference. On the other hand, if we did get a difference and we got a p-value of, let's say, 0.023, it does not tell us which group is different from the other. Now, by looking at the means for each of those groups, we can kind of guess it, but we should not guess it. There are, and then you have a whole session on post hoc tests tomorrow, so that will be covered there, but I'm going to just mention these names of these tests so that you're familiar with it. Okay, so now we do not know which group differs from which, right? So to compare the means between the groups, we need multiple comparisons of what we call post hoc tests. And first, before we go to post hoc tests, let's see how to report the results of this 300 patient study that we just did, right? Our results must have a significance value, must have the F statistic, and it must be preceded by the degrees of freedom. And this is how we write it. There is no significant difference between the pain scores of the 3 drugs tested. P 0.011, F statistic, 2 degrees of freedom for the groups, and 297 is the degrees of freedom for the overall sample size. P, this equals 1.741. 1.741 is the F statistic, and this is the P value. This is how we report the results. Right, we had this issue now. Which group is different from the other? Firstly, if there is no overall difference, we should not be conducting post hoc comparisons. And yesterday, I think Dr. Chitranjan did mention about conducting post hoc analysis, fishing expeditions, and going and trying and doing multiple tests so that something comes out positive. No. When the overall comparison is not statistically significant, we should not go to the next level. And then the same principle holds good for subgroup analysis, which many of us unfortunately try and interpret a bit too much. So post hoc comparison, right?
Dennis, 1 minute.
Yes, I will finish in 1 minute, sir. 1 or 2 minutes if you can give me. ANOVA doesn't say how or which ones differ, right? We need to conduct post hoc tests, and these are the post hoc tests. And you would have read, I'm sure Bonferroni test or Bonferroni correction is familiar to us. Tukey's and Dunnett's tests are common. And on this side, we have the Games Howell test. I'll just mention this, we'll not go into details. So I'll just conclude by telling, just introducing the different types of ANOVA. So one-way ANOVA is when we have one independent variable and relieving pain with the drug, where the drug is the independent variable and pain is the dependent variable. So that's a one. When we say ANOVA, by default, it means one-way ANOVA. We have repeat measure ANOVA when subjects of a sample are measured under different conditions, right? So this can also be comparable to a paired t-test, right? Pain scores of patients treated with the drug at 3 months, 6 months, and 12 months. We can do that as well. And factorial ANOVA is based on a number of independent variables. When we have two-way ANOVA, there are 2 independent variables, like for example, relief of pain with drug and gender. I want to know with this drug, and the other drug between males and females. Can I do that? I can do that. Drug and gender becomes independent variables and the pain becomes the dependent variable. Then we have the multivariate ANOVA based on the number of dependent variables, like for example, different drugs resulting in a significant difference in ratings of pain relief, range of movement, and distance walked, perhaps. So to summarize, ANOVA is to compare 3 or more means depending on the number of independent variables and conditions. Different types of ANOVA are chosen. If ANOVA is significant, it means that at least one group is different from at least one other group. But for now, we don't know it, right? In our example, we did not have it overall different, right? ANOVA does not reveal which population means differ from which. Therefore, we need to conduct this post-hoc test to compare between groups. And the post-hoc tests I did mention to you are Tukey's, Dunnett's, and others. So let me close with this table, which will be available to you. So today we did t-test, we did ANOVA, we did a bit on matched pair test, and also a little bit on repeat measure ANOVA. The corresponding non-parametric tests, which we learn tomorrow, are the following: Mann-Whitney, Kruskal-Wallis, etc. Thank you very much for your attention.
Thank you, Dennis. That was extremely good. At least you made it very easy and clear to, even statistically new person like me. Thank you very much. Gopi, you have anything to add?
Nothing. I just like to thank Dr. Dennis for the talk. Yes, a lot of things do look familiar, but still I think some things, even after you have said, are still unfamiliar to us. Probably we'll need to do more of, practice this more often and then maybe get it. I'm sure the participants also would feel, many of them would feel the same. There are some questions, maybe you could take them and see if you could answer some of them. Thank you.
Thank you, Dr. Gopi. It's like me coming out to your cath lab and asking you, can you teach me angioplasty in 15 minutes?
No, but anyway, it was important. At least we got some understanding now. I'm sure.
We'll always take the questions from there in the box, in the chat box, Dennis. Can you read the chat box?
Oh, okay. Q&A. Okay.
Dr. Anusha asks, how confidence intervals are written and how are they important to say about the quality of the study?
Okay. That's a very good question. And it's really important these days that we understand, the 95% confidence interval. There's also 99% confidence interval. So what does this mean? I'll keep this as simple as possible. So always research is done on a sample and it is interpreted to a population, right? I get a particular, now let's say, what is the mean age of students writing the 10th standard exam, right? Maybe it is 14.9 or 15.6. So that is the mean age of students writing this exam, right? But is that the same? I mean, this is in 5 schools in Bangalore. Is this the same for all schools in Bangalore, right? Then I can't go to all schools in Bangalore. Therefore, when I calculate the mean age, I also calculate the 95% confidence interval. It's plus or minus square root of the standard error of mean, etc. We leave out the formula for now. Then I get 2 values. So these 2 values are around this point estimate. So my 14.8 is the point estimate, and I have 2 bounds, upper and lower bounds, right? And many times you'll hear people when they're presenting, this is a narrow confidence interval. It's really precise estimate. It's very good, excellent study. And if you look further, you will see that, there was a large sample size, etc. So now what does this mean? These 2 boundaries, what do they mean? Leaving out the statistics there. This boundary simply means if I repeat this test 100 times, if I repeat this test 100 times, 95 times I'll get my point estimate within these 2 bounds. Like for example, if I got 4.8 as my point estimate, 14.8 as my point estimate, and 12.0 and 16.3 as my upper and lower bounds of the confidence interval, then if I do this 100 times, I will get this within this boundary itself, and that's the 95% confidence interval. The narrower it is, the more precise is your estimate. Right. I hope that was reasonable. Shall I go to the next question? What is the minimum number of samples in each group to do ANOVA? Okay. One answer is very simple. There are 2 parts to this answer. How many groups do we have in an ANOVA? I already mentioned it more than once. We need at least 3. If you have 2, you just do a t-test. You don't have to go through all this, right? Minimum, we need 3 groups to do an ANOVA. Within a group, how many people depends on your sample size estimation. And I do not see in our program for over 3 days, a topic on sample size estimation, which is very, very important. So simply put, in sample size, I must have adequate number of people who will give me the information that I want. Now, if you're doing, a large cardiology trial, it's not just the number of people, but what kind of people they were, how much of risk level they had, how long we followed them up, and what was the rate of follow-up. All of this gives us events. Events is what enriches a study and helps us to, and in the end, we're not counting the number of people, we're counting the difference in the number of events. So, Dr. Rekha, I hope I answered your question, which is to find out the minimum number of samples in each group, we need to do a formal sample size estimation. It depends on so many different parameters. And maybe the next time the academy, Karnataka Academy does this, we must have a session on sample size estimation. If there is time, I'll answer the last question. In simple words, what's independent and dependent variable, right? A dependent variable is affected by a particular intervention. An independent variable is, let's say, age or gender. The pain, ability to walk, ability to lift a particular weight after this intervention is the dependent variable, right? And dependent variable comes on the x-axis. I hope I was able to answer Dr. Nagaraj Murthy. Thank you. Sorry, I overshot time, but I hope that was useful and clear.
Dennis, what we have discussed, we can stay on till 5:30. Maybe if the time permits, we can take some more questions and probably you can answer some of those questions.
Thank you. Thank you.
Thank you.
Thank you. Thank you very much. Thank you for all the participants.
Thank you, Ramesh. Thank you, Gopi. Thanks, Dr. Dennis, for that excellent talk.